Of the victims that we received, and then we'll let him introduce one of our trauma surgeons. Dr. Steele?
Right. Thank you, Charlie, and good afternoon. I'm very pleased to report that of the 8 gunshot wound victims that were received, 5 of those were dismissed from the emergency department last evening. 3 individuals remain in the hospital. 1 is in stable condition. The other 2 were admitted in critical condition. They remain in critical condition in our ICU, but they both are improving, so that's good news. It's my pleasure now to introduce a couple of our outstanding trauma surgeons, Dr. Dustin Neal, who serves as medical director for our trauma program, and Dr. Anuj Shah.
Hello, I'm Dustin Neal. I was told to spell my last name. It's N-E-E-L, and this is Anuj Shah. I don't know if you spell your name or not.
I don't know. My last name is Shaw, S-H-A-H.
So, as Mr. Shields and Dr. Steele mentioned, we're a level 1 trauma center. We just finished our recertification in December. We were the first level 1 trauma center in Kansas City, Missouri. And one of the big things that the American College of Surgeons wants is to know what our mass casualty plan is. We go through that during the survey. We talk to the people who help maintain it. And we practice it, as I'm sure you all are aware. We have a mock mass casualty trauma every year that's citywide. And mock patients come to us from various sites, and we practice this so that should an event like yesterday unfortunately happen, we're prepared for that. The thing that makes us special is the medical director of KC Fire is also an emergency medicine physician here. She was at the scene and was able to triage these patients appropriately, very quickly and efficiently, which ultimately allowed the sickest people to get to us first, as we're the closest hospital. The first person who arrived, as Dr. Steele mentioned, that's in critical condition, had he not made it here as fast as he had, he might not be with us now. He sustained extremely life-threatening injuries, and fortunately, thanks to Dr. Carney's triage, our KC Fire and Police Department, he was able to get here quickly. He was the first person here, and our mass casualty plan then went into effect and got him straight up to the operating room, and we're able to stabilize him. And as Dr. Steele mentioned, he has improved overnight despite his life-threatening injuries, with plans for future operations today, and hopefully he'll continue to improve. Dr. Shaw?
I want to reiterate that we did have excellent coordination between KCFD, KCPD, and they did a phenomenal job on scene with their disaster response. Their coordination with University Health has allowed these patients to survive. We're very happy to say that we didn't have any deaths in the hospital. Unfortunately, there was 1 death from this event. But those that were critically ill were able to get to us in a timely, efficient manner so that we could provide care to them. And so the coordination between all of the departments, citywide, between all the hospitals, especially with University Health, allowed for our disaster response to be as robust as it possibly could be.
You spoke about 1 patient who is in critical condition. Can you talk about the other patient that's in critical condition? What's happening with them?
The other patient who was also in critical condition was the second patient who arrived to us. Fortunately, she was more stable than the first patient, but ultimately did have to go to the operating room as well. She is recovering in the ICU and improving. We're hopeful that in the next day or 2 she will be able to be moved from critical to stable condition and get out of the ICU. But again, a lot of it has to do with the coordination between KC Fire and the triage at the scene to get her to us next.
All right, we have been hearing from doctors and officials at Kansas City University Hospital. They said that they received 8 gunshot victims. 5 of them today, they were happy to report, have been dismissed. Of the 3 that remain, 1 is in stable condition. 2 are in critical condition in the ICU, but they are improving. One of the doctors who treated that patient, one of those critical patients, said that they received that patient in extreme life-threatening injuries It was the first person to arrive, and because of their close proximity, they believe they were able to save that person's life. We also know that Children's Mercy received 12 patients, 11 of whom were children. 9 of those kids had been shot in the incident. 3 are still inpatient, but all are expected to recover. We're going to continue monitoring this, but now we head over to the White House. National Security Council Coordinator for Strategic Communications, John Kirby, is speaking at the press briefing about some national security threats. We want to hear what he has to say.
The cost of inaction by the Congress is stark, and it's being borne on the shoulders of Ukrainian soldiers. We need Congress to pass the National Security Supplemental Bill without further delay. If House Republicans do not act soon, what is happening in Avdiivka right now could very well happen elsewhere along that front. So again, we need Congress to act right away. Questions?
Thank you. Addressing the matter that you